that AI has also entered the medical exam room, recording devices that are capturing your visit, including what you believe to be a very private conversation with your doctor. Here with a warning today on Crosstalk, we welcome back Twyla Braze, the president and co-founder of Citizens Council for Health Freedom, a national patient-centered, privacy-focused, free market policy organization to support healthcare choices, individualized patient care, and medical and genetic privacy. Twyla is a certified public health nurse, author of the 8-time award-winning book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records. She's also the speaker on the daily Health Freedom Minute, heard on stations across the country. Twyla, thanks for joining us here today on Crosstalk.
Always good to be with you, Jim.
So, Twyla, many will be shocked to learn that in many exam rooms across the country, AI, artificial intelligence technology, just may be recording and transcribing your personal visit to your doctor. Tell us what's going on.
Well, and as I talk about this, your listeners, as they think about this and as they go to the doctor's office, I'd love to hear what happens to them. I'd love to see the forms. I'd love to see pictures. So just before I even start, I just want to add that to your listeners. We're gathering more information from the exam room, and we need everybody to help us. So what's happening here is it'll come across in a variety of ways. Well, maybe I should just say what it is first. So artificial intelligence or ambient listening is what it's called in the exam room. So a variety of different kinds of devices that could be listening to your entire conversation. They could be on even when the doctor or the nurse or the aide is not in the room. It kind of depends on the device. It depends on the technology, and it depends on where the device is. Sometimes patients are told this is happening. Sometimes they're not told at all. Sometimes they're told at the end, after the entire thing has been recorded. So just as an example, in the news, and people can look this up, the Mayo Clinic now has their nurses recording the entire encounter if you come into the emergency room. Some people have found in the exam room, I had a picture of this, and it was a poster. It wasn't really a poster. It was like just a piece of paper. Maybe it was kind of poster-like, but it was just the size of a piece of paper. And it basically said ambient listening in really big letters. And then if you read the print, it says, by continuing to remain in this room, you have consented to having the conversation recorded.
Wow.
Yes, and so just think of all the things that happen when you go into the exam room, right? Are you going there with your crying child? Are you going there with 3 children who are taking all of your attention? Is your husband dying, and so you're comforting him? You're not looking at signs on the wall, right? I mean, you have to be sitting there waiting around with nothing else to do, and then if you don't even understand English or can't understand it well, then you're not even going to read it.
And Twyla, on that point, and we'll have you continue on, but on that point, I mean, there are times you mentioned about having your spouse with you in the exam room, or perhaps a parent with a child, or sometimes you're taking your elderly parent, and there are times in which you have some very personal conversations with the doctor outside the room, conversations with your mate or with your child or with those elderly parent with you. What you're saying, these conversations may not be exempt from the recording?
So it depends on the recording device. So sometimes what it is a phone that the doctor brings in. Sometimes it's the computer that the doctor or the nurse or whomever the scribe is. No, usually there's no scribe. Sorry, take that back. This is the AI scribe, so they don't need a scribe in the room. The other times it's a discrete recorder located somewhere in the room. And then it's a matter of the process of turning it on. Does it get turned on before the doctor enters, and so everything is recorded, but as soon as the doctor leaves, there's nothing happening because the phone went with him? Or is it turned on because outside the exam room, they flip a switch, and it begins to record the conversation. Now, the thing that I would say is this is such an intrusion at many, many levels. But the exam room, and I'm a nurse, the exam room has been considered sort of a sacred spot, a sanctuary where you can tell all the things you might have to tell to get the care that you need. You know, it's a place where there shouldn't be a third party. It's a place where you should feel safe. Even the fact now that they bring in a person, a medical scribe, and they just bring them in and say, this is my scribe, right? Well, this is a third person in the exam room that you may not want to be there. You may actually just want to ask the doctor something, and you don't want anybody else to hear the question or hear the answer. And so I just want to say, sort of as a aside here, you are not required to have the physical person, human, scribe in the exam room either. And if you ever want to have a confidential conversation, you tell the doctor, I want the scribe to leave. It's as simple as that. I want the scribe to leave, or I want that person to leave, or I don't want anybody else in here because I want to talk with you about something confidential. You need to have that person leave. So you as a patient have the power to do that because they actually know that there shouldn't be anybody else in the exam room taking notes. Just because they happen to be on a computer, I mean, who are they? What do they do at night? Do they talk with you? You know, they're just a person taking notes of the conversation. But now, to try to not have to hire those people and to make it all easier, they're bringing in these devices, or they're posting these devices. And you are right about the conversations that you could have, whether it's on or whether it's not on, and how do you know whether it's on, how do you know whether it's off. And so, you know, if I might, I'd like to just describe some of the ways that you could find out if there's a scribe, an AI scribe, an ambient listening device, and then, you know, how to get it to turn off or shut down.
Sure, and I've got a whole lot more questions on this too. But go ahead. How do we know? I mean, you mentioned sometimes a sheet of paper being there, and then you also mentioned that sometimes people are told after the visit, oh, by the way, this visit was recorded for transcription purposes. So guide us. How do we know, and what can be done?
Okay, so when you come to the clinic, look at the papers that you're given. So one time I was given multiple papers, right? But one of them expressly said at the very top, it was just for ambient listening, and it wanted me to say yes or no, that I agreed to it or I did not agree to it. Well, that's pretty obvious if you can get to that point in going through the papers. Sometimes it'll take you into the room when you're not done with the papers and just say, oh, you can finish them in the room. And if you have not looked through the papers, you might not notice that there's an ambient listening consent form. Mm-hmm. Another is the kind of sign that I told you is up in the room. And likely another one, which I haven't seen them, and that's one of the reasons I'm asking your people to send us things if they find them, is that it would be embedded in a multi-consent form. You know, you've seen those forms where it says, I agree to be treated, I agree to be billed, I agree to submit to HIV testing if I get stuck with a needle, I agree to this, I agree to that, right? It's just, there's one form that we have here that's got like 23 different things on it and one signature. These are coercive or consolidated or multi-consent forms, and that's a whole nother discussion.
And Twyla, and there's a lot of people who don't get any paper forms. They just, somebody will be sitting beside a computer and they say, down there you have an electronic thing to sign, an electronic pen, and this is just a consent form for your treatment today and for us to bill your insurance, et cetera, et cetera. Could that form also have this information on it, that one is blindly accepting that by putting their name on with that electronic signature?
Right. So the iPads that you might get, or the other kind of form like with HIPAA, they often just give you this 4 or 5 inch by 5 inch little device and say, oh, that's just HIPAA, and you have no idea what you're signing at all.
Right.
Right. So it could be part of that, and so it's really important to just sit there and don't feel pressed. Look at everything in that consent form, and you might find ambient listening, or it could be artificial intelligence listening. But typically what I hear, and is actually been written about in the news, it's called ambient listening. And so they could also just come in the room and ask you. So this happened to me once as well, where the doctor walks in with a phone in his hand, and he says, I'm going to be recording this, okay? And I'm like, no. And he said, well, then it won't be as complete. And I just looked at him, and he turned it off and put it in his pocket, right? So, and even then, he could have decided to put it in his pocket, and not turn it off. Mm-hmm. But, that's the thing where you just have to stand up and say no. But see, he just breezily walked into that room. He asked for that as though it were consent. That's not real consent, because it's a powerful person coming in the room with skills that you need. And to ask it in that way and then just say okay is to not really ask for your consent. They can say they did, but it's not real consent, because real consent honors the patient, makes sure the patient knows exactly what's going on, what does it mean, where does the data go, right? Because they send it away. So somebody else is transcribing, or some machine, or somebody's system of machines is going to transcribe everything that was recorded at that visit, and will send it back in some summary form to the doctor.
Okay, and we're going to pick up with that after the break. Friends, this is information you need today. Twyla Bray's with us from Citizens Council for Health Freedom, cchfreedom.org, and we're talking about AI in the exam room. When you believe you're having a very private, personal conversation with your doctor, or even when the doctor's not in the room, is something else listening in? We'll be right back.
Back to Genesis with Dr. John Morris, popular creation speaker with the Institute for Creation Research. Dr. Morris, did Noah's Ark have to contain 2 of every species we find on planet Earth today?
Not at all, Chris. In fact, this is a straw man argument used by those who really don't believe in Noah's Ark at all. The Bible says that God created each basic type of animal after its kind, and that Noah was to bring 2 of each kind of animal on board the ark. Kind would be represented by the basic categories of animals today, such as the dog kind. Within the dog kind, there are several species. That's the wolves and the foxes and the coyotes and the dingoes. They are called species, but they're all interfertile. They're all part of the dog kind. There was plenty of room on board the ark for 2 of each of these various kinds of land-dwelling, air-breathing animals. The Bible story holds water, as it were. We read about it when we go back to Genesis.
For more on creation, visit our website at www.icr.org.
AI in the exam room, our topic today with Twyla Bray's, the president and co-founder of Citizens Council for Health Freedom. Yes, we're talking about the use of artificial intelligence, ambient recording going on right in the exam room, and many times patients just even not aware or oblivious to what this really is. Now, Twyla, just as that break came upon us, you were starting to talk about this recording itself, and the question that I want you to reiterate or respond to is, where is this recording going? Who has access to it? Is this just for the doctor to listen to later by himself to make up some notes in your file, in your chart, or what happens with this recording?
Well, it seems a little bit up in the air, and it probably depends on the system. So there are 7 major AI or ambient listening systems that people tend to have. Some of them are more expensive per month, and some of them are less expensive per month for the clinic. And so it depends probably on what is in the fine print of the contract as to the possibility that third parties get it. Well, what you know in the first place is that the company that they have contracted with, clearly there's some arrangement there, because the doctor's office is not recording this. The recording is coming back to them. Mm-hmm. And then what the agreements are of the ambient listening company with others in or outside of the country. I think it depends probably what's in that contract. So I think there's a lot yet that we do not know about ambient listening, but what you can be assured of is that it doesn't just stay in the doctor's office and somebody there listens to it and transcribes it and puts it through in some kind of AI system to have it, come out as a printed document. I am quite certain that it is something that happens outside, and then it is sent back to the doctor. The doctor is then given either a summary or however they best like to have it. Then they are supposed to check over and make sure that what happened or what it's written up as actually happened, that there aren't any fake facts in there, right? Yeah. There aren't any misstatements. And that's an interesting thing, because if the doctor is depending on a machine to record things, there are going to be errors. So I don't know what kind of audience you have as far as if any of them do voice to text or voice to email, right? They turn on the record and they start saying these things, and then they press send. And then sometimes they look at it and go, oops.
I didn't say that.
Okay, I didn't mean that word. Right?
Yeah, right.
And so here's a doctor who's seen a whole bunch of patients during the day. Now he's got to figure out, okay, what really happened in that exam? Because he didn't write any notes. He was just listening and watching, right? So does he remember actually what was said? Does he remember what he thought? Was it accurately written in there, or was it not? And so I think there's a lot of things that are up in the air, but we clearly know from ambient listening that errors will be made. Whatever the machine hears isn't necessarily what was said.
There is an error rate in these AI-generated notes. I saw the term used for these errors are called hallucinations. Interesting term there.
Well, that's correct. And that is in anything artificial intelligence. Anytime, like if you want to ask AI to create a document and you give it 5 different points that you want to make and you want it to have a conclusion and all this kind of stuff, right? Then it will create something. But if it doesn't have enough data to create something, it will pull data from other places and it will hallucinate, which means it will just start making up facts. And this is why whenever you go on the computer and you ask for a search, it will say, AI makes mistakes. Please check. So you have to go to the sources and learn whether or not this is actually put together right in the AI summary. So this is the same thing, of course, that's happening in the exam room. Now, in this case, it's an actual recording. So it shouldn't take other information for it, but it can make mistakes about the words that the machine heard or translated into a word.
Right, just like you pointed out about the voice to text. I see that happen all the time, different words. But if they're not corrected, Twyla, it's going to be deemed as being truth.
Right. So this is the other thing. So if the doctor thinks something is true, or, the doctor, it's late at night and, okay, yeah, that's probably what he said. Or, I think that was the correct thing that I said for the diagnosis or whatever. Right. It's just that we don't know. And then if the patient needs to be able to look, but what patient has time, to go in and see that there aren't errors? And then as these errors get added to the electronic health record, and the electronic health record is hooked up to state health information exchanges, and the state health information exchanges are hooked up to the national e-health exchange, these errors can be used for research. These errors can be used for your next doctor who thinks you actually said that, or your next doctor who thinks that was the actual diagnosis when it really wasn't, because somebody didn't check carefully enough, or it was too far between the appointment and the check about what the ambient listening company says happened in that exam room.
Twyla, you said something earlier, and I just had warnings go off in my mind. You used the term third party. And this is something that happens often. So this is a third party that is doing this. And I've seen some of these disclosures. I saw it on in an insurance company not long ago, which they mentioned that, your information is personal and private. We will utilize a third party. And when you read the fine print, they said, though we can't control who the third party will share this information with. We won't do it, but we do use a third party, but we can't control, we don't have control over their third party people that they will share this information with. So when we hear that third party and this recording this, we really don't know who is all going to have access to this information.
Well, that's correct. Now, you can look at HIPAA, and a lot of people in your audience are probably thinking, but what about HIPAA?
Right.
Well, first of all, HIPAA doesn't protect privacy. That's the first thing. It's a permissive data sharing rule, so all sorts of people can have access. If those like your doctor, the hospital, the lab, whomever, decide to give access. Now, there's another thing that's under HIPAA, and that's called business associate agreements or business arrangements. And so they can have these arrangements, these contracts with other businesses like AI companies or ambient listening companies, and they can have requirements in there that those companies cannot share the data without the consent of, like, the hospital or the doctor or whomever, right? But it's really hard for the hospital or the data system or the clinic to know whether or not data was shared. And there's a lawsuit. There have been several lawsuits just about this whole idea of, one, you're taking this information from me in a recording and I didn't know it. And the other is that the data is shared more broadly. It's than the patient thought it should be shared with these other third parties. And so these kind of things can lead to lawsuits, but there
are lawsuits going on.
To sue, and only if you figure it out. And then, do you really have the money, the wherewithal? Do you really have that? And even HIPAA won't give you the kind of relief you're looking for, because HIPAA doesn't give you a private right of action. It only lets the government, charge them with fines if the government finds them guilty.
Yeah, and I understand there are actual lawsuits going on as we speak by patients who had no idea this was happening, no notice, no direct consent, or, as you mentioned, passing along to others who they felt it was just too broad a sharing. So those lawsuits are happening right now.
Yeah, they are happening, and I talked to somebody who was an AI or is an AI expert, and he was in the doctor's office, and at the very end of his visit, the doctor said, "Oh, by the way, I recorded that entire visit."
Oh, my.
And this AI expert said, "I am more worried for you than I am for me. You should have told me. But now you are liable for every word that was said in our visit. Every word you are liable for, because it's now all been captured. It can all be discoverable in a lawsuit, and you could be sued for whatever somebody decides to say you said wrong, or you didn't pick up on, or you this or you that, right?" And so there are all these things. And I will say the reason that we are at this point is because of third-party payment for health care. But even more than that is because the Obama administration and the Democrats who were in charge at the time mandated that every doctor and every hospital use an electronic health record that is approved by the government, and it has to be used meaningfully according to government regulations. So you've got to use the government EHR, and you've got to use it the way the government wants you to use it, which is reporting all this data. And if we didn't have that, we wouldn't have medical human scribes in the exam room. We would just have a doctor with a pen and a chart and a patient. We wouldn't have AI. So all of this adds layers and layers and layers of costs, but also intrusion in what is supposed to be a confidential conversation where and time. It also consumes tons of time, taking the doctor away from the patient. So it's really, it's really been a disservice to patients to have all of this All of these mandates come from the federal government, taking the doctor and the nurse away from the patient to do all this paperwork, and now bringing third parties into the exam room so that they don't have to fill out as many forms.
Twyla,
and they can just all be entered.
I'm hearing Nancy Pelosi right now at the time. We need to pass this so we can find out what's in it. And we are continuing to find out what's in it. And because what you're laying out here is all the fruit of what happened back then when those seeds were planted and then passed by Congress in a very inappropriate way. But, we need to pass this so we find out what's in it. And Twyla, I don't like some of these things I'm hearing that are in it.
Yes, and well, I wrote a whole book, Big Brother in the Exam Room, right?
Yes.
And I told the whole history of this.
Mm-hmm.
And so the Obama administration knew that they had to socialize the health data system before they could socialize the healthcare system.
Mm-hmm.
So they had to socialize the data before they socialized the care and the coverage, essentially, is what one of the things that I found out as I wrote the book. And so this was all planned, and it's all a destruction of the healthcare system for the needs, the purposes, the agendas, the profits of outsiders. And it's all hurting the doctor, hurting the patient, and causing all sorts of doctors to leave well before they ever thought that they would leave because they just can't handle it anymore.
Yeah. And friends, many of you know that because you've experienced the shortages, waiting months, half a year to get into a certain specialist, and many who have left the field of medicine just because of things like this, because of the requirements that are being placed upon them, those who have given up private practice in order to go into healthcare systems where somebody else will be dealing with those headaches, and yet those systems are what leading to this. We're going to take a quick break. We're talking with Twyla Braze of the Citizens Council for Health Freedom. Their website, cchfreedom.org. Now, we will open phone lines a little bit later, but friends, I'm going to have Twyla comment on this as well, because there's also a problem when not only with AI, taking these notes and being that observer to what's happening in the exam room, but there's also a problem with AI directing one's health care, AI being used to give prior authorization or the denial of prior auth. So we'll get into some of those matters as well. Back in 1 minute. You're listening to Crosstalk.
Proverbs 21 verse 1 says,
"The king's heart is in the hand of the Lord, as the rivers of water. He turneth it whithersoever he will."
just as God worked through the kings in Israel, so he also works through the leaders of human government in countries around the world, including the U.S. In the book, Presidents, Politics, and Prophecy, author Richard Schmidt has transcribed and expanded intriguing lectures from Dr. Jimmy DeYoung Sr. You'll see how God has worked through world powers in the past to accomplish his plan and purpose for today and the future. With a review of each of the U.S. presidents from Jimmy Carter to Donald Trump, you'll find key initiatives that have prepared the world for things to come. VCY has made available Presidents, Politics, and Prophecy for a donation of $18. Call 1-800-729-9829.
You're listening to Crosstalk on VCY America, and medical privacy, folks, very much at stake. We're talking about AI in the exam room, and I'm going to get to this matter of AI directing healthcare in just a moment. But Twyla, we were talking about third parties and who has access to this information. It was June 17th, 2026. There was a column on townhall.com in which a federal grand jury in the Southern District of Florida returned a multi-count indictment charging a Miami woman with allegedly orchestrating a years-long scheme to obtain and see the confidential Medicare beneficiary identifier numbers of thousands of patients for use in a Medicare fraud scheme. And this got me to think, could people who have access to this AI information from the exam room use it for clandestine purposes, either to sell information to others for a price, of course, or could, I guess, even be used for blackmail down the road. But usually it is selling this information out to companies who then harvest it for other purposes?
Yes, it's a very big business. So one of the things that I write about in the book Big Brother in the Exam Room is the Hall of Shame. No, they call it it is a Hall of Shame. And this is the list that the U.S. Department of Health and Human Services keeps of every data breach that's reported to them. And lots of them don't make the news. So there are ransomware attacks where particularly a foreign government or a foreign actor or whomever just comes in and shuts down the hospital by taking control of the data system. The one thing that has transpired, because we have been forced to move by the government into everything being electronic, is that it's all hackable. It's all hackable. The Pentagon's records were hacked. It's all hackable. And so as soon as you put it online, you make it available for all sorts of nefarious actors. And, when it was a file, a medical chart in a file cabinet, okay, you could come in, you could break in, you could find the file that you wanted. But when it's all digitized, you can just seize the entire thing. Yeah. You can shut down entire hospitals. So, this ability to gain access to data, to do blackmail, all of that stuff, it's all out there depending on who's looking, who has power, and who has the strategy to go after the data. So systems will always try to, be cyber secure. But one thing I found out in my research is if we took all of the cybersecurity agents or workers today, all of them, and then we looked at all of the job openings for cybersecurity, we could take everybody who has currently got a job and put them in all of the openings, leaving, of course, no more jobs that they were in, right? So there's like twice the number of jobs that there are people who can even do them. Wow. So what the nation did, what Congress did, was make us all vulnerable. As individuals, we don't have the same security anymore, and as a nation, we do not have the same security anymore because everything's being digitized.
Yeah. Twyla, let's talk about this problem with AI also in the direction of people's health care. And I understand that AI is also responsible for automatically generating these letters denying prior authorization. So if you would comment on that issue.
Yeah, so the health plans have been doing that for a while, and I think it might be United Healthcare that's maybe in a lawsuit. There's some health plan that's in a lawsuit having to do with the use of AI and doing these auto-generation of rejections, of prior authorization rejections. I'm pretty sure I'm correct about that, but I'm not looking at the data. But anyway, this is becoming a bigger problem because the health plans and the institutions are looking at AI to be the solution. So they can just point to AI and say, we didn't deny the care. Our computer looked at all of your data and all of your history and all of your this and decided that it's by the standards that's not medically necessary for you. There's an article that just came out about 12 nurses at one institution who were just fired, and the hospital is going to use AI to conduct not prior authorization, utilization review, but it will lead to prior authorization requests and denials. And so they've all been fired, and the hospital is going to depend on computers to do their job. Right. Then there's the fact that CMS, the Centers for Medicare and Medicaid, are now bringing AI into the Medicare system, into original Medicare, in 6 pilot projects in 6 states. And in those states like Washington and Arizona, the stories, or is that Ohio? Anyway, I know Washington for sure, but there are stories coming out from these states of people waiting twice as long, of them having to come back for another appointment. So it's delays, it's denials, it's, okay, you have to go through this entire process with AI again. You thought you had an appointment, but no, you don't, so go back. So there are these stories that are coming out from the computer. And one of the nurses that was fired, she said something to the effect that, we would like AI to come and help support us in our job, not take our job. Yeah, and, those AI machines, they're not going to know, because they're not people. They're just computers. They've just been programmed by somebody, and they take all the data, and they don't have any moral code. They don't have any ethical basis for what they do. They get certain data, they interpret it a certain way, and then out it comes. They don't know if there's even a person at the person's home who can take care of them when they get home, but they just say, it's time for you to go. Your care is done. Go home.
And when people get these denial notices, do they know whether or not AI was the one involved in making that decision?
I haven't heard whether that is noted on there or not, but we do know that the health plans have talked about the fact that they are increasingly using AI in order to speed up prior authorization. But of course, they may deny things for certain patients that need things, and they may give extra care to other patients depending on what does the data say. If somebody does really good data, feeds it into the computer, or feeds it into the health plan, and because they know how to work the system electronically. Well, if I add this, this, and this, and if I report this, this, and this, I'll be able to get the care, whether or not that patient actually needs it or not. But a real person can look into the records, can look at the patient, can talk to the family and go, okay, this will work or this won't work, whatever.
I read in one of your reports at CCHF that the government is paying private companies that use AI to authorize or deny claims, and that these companies are then paid a percentage of savings from every denial.
Yes, that's for the new prior authorization program for Medicare, original Medicare in the 6 states. So this is some kind of a contract that the federal government has to try to eliminate fraud, waste, and abuse in the Medicare program. But it also just makes it easier for them to deny things. And then, of course, you have to go through the appeals process. And we know in Medicare Advantage, which I can't say concretely uses AI, but of course United Healthcare has Medicare Advantage. So I'm just going to say it probably does, and it's increasingly going to. But in the past years, including in 2015, when there was no AI, people were being denied access to care. And what they found is that the appeals process, so whether it's a quick and easy denial, whether AI or by a person, the appeals process is an elongated process. And what the federal government found is that 75% of the time, if you appealed the denial of your medical care, 75% of the time the health plans would turn around and reverse their decision and give you the care. But only 1% of people who are denied ever appeal.
Wow.
So it is a very lucrative thing to simply deny, and see who has the wherewithal, who has the energy, who has the family, who isn't actually dying so they can take the time to go through the appeals process, right?
Right.
And so the federal government said, this is a burden on seniors, because this was Medicare Advantage, right? So these are all seniors. It's a burden on seniors, and, lots of them just don't go through the process.
Yeah. Friends, you're listening to Crosstalk on VCY America. Twyla Bray's with us today, and she's going to provide us some contact information here momentarily. But I'd like to open our phone lines. No doubt you have a question you'd like to ask or a brief comment. Our number, 800, maybe you've encountered this in your doctor's office, 800-733-9829, 1-800-733-9829. Now, Twyla, you said you've got a project going on. What is that project about?
Yeah, we have a project it's an awareness and engagement project to get people to see ambient listening first. Go in and look for it. Just have to look for it and ask questions. Is there ambient listening in this clinic? Is there ambient listening in this room? Everybody who comes into the room, you have to say, is there ambient listening? So we actually created, when you go to a hotel, you've got that little thing on your door, which you can say privacy, or I don't want shades, or don't disturb me, or whatever, right? And you hang it on the outside of the door. We created a door hanger to hang on the outside or the inside of the clinic door to say, privacy, please, no ambient listening. I do not consent to ambient listening or recording devices in my exam today.
Wow.
And so it's yellow. It's kind of fun. But it's serious. It says privacy, please, in really big letters. So we are taking that to Freedom Fest in 2 days here, and we're going to see how that goes, and we'd love to hear the stories back of how did this work for people. You just stick it on there, and as soon as people are coming in the door, they're like, oh, they clearly don't want ambient listening.
And you really want people from around the country really to relay experiences to you at CCH Freedom, correct?
Yes, that is correct. We also have an ambient listening one-pager, which is soon to go up on our website at cchfreedom.org in our helpful handouts section.
Okay. Again, friends, our website, cchfreedom.org. And for more information, we're talking today about AI in the exam room. Our number, 800-733-9829. Randy is calling in from Dodgeville, Wisconsin. Randy, you're on the air.
Thank you, Jim. I was going to say that, let's not forget that AI, we just didn't call it AI, has been around for quite a while. It's just a big computer, a lot of memory, very fast, and can process data. But let us also remember that anything developed by man can be hacked by man. Mm-hmm. Years ago, I worked in security at a major medical institution. I wasn't in charge, but, whatever we did, somebody's out there that could override it.
Yeah. Thank you for that, Randy. And, Twyla, that's the point you made earlier, that we're hearing of hacking all the time that's taking place in many different settings. People have gotten these notices regarding that, and there's no exception to this, but people's information leaves people very vulnerable.
Right, and I don't know, I was just going to say here that I could not hear his question because it was just going in and out, so I can mostly hear your question, but I don't know how I'm actually coming out to you.
Yeah, you're coming great.
But if I'm coming out great, then I will just say that, yes, people are vulnerable. They have a need. They are there for a need. They're hurt. They're scared. They're injured. They're ill. They could be. I'm an ER nurse, so I saw everything, and so you don't want to be having a battle in the exam room, but today you kind of have to.
Yeah.
You kind of have to. You have to be aware of everything that they want to do to you and what they want to take from you.
Friends, we're going to take a quick break, and we'll come right back to more of your phone calls. This is Crosstalk on VCY America.
For the Worldview Report, I'm Brandon House. Our website's worldviewtube.com. President Trump is in Turkey today, giving great praise to Erdogan. He's also praised the leader of Syria, Jelani. Folks, I don't know about you, but I don't remember any president, certainly Republican president, that has given so much credibility to Islamic leaders. Do you know of even one Republican president that has ever done this? Praising the leader of Turkey who wants to take and conquer Jerusalem. And then we have Jelani, who had a multi-million-dollar bounty on him from America for being a jihadi. Of course, President Trump, I think, is going after the Abraham Accords. All of this, folks, is setting the stage. Do you realize that? For Bible prophecy to be fulfilled, for a leader to come along, I think, after Donald Trump to confirm a peace treaty. But then there's Israel wondering what's going to happen as America, gives Turkey F-35s. May God protect Israel.
This is Crosstalk on VCY America. Twyla Bray's with us today, cchfreedom.org, the website. And right back to the phone lines. Susan is calling in from Phoenix, Arizona. Hi, Susan, you're on the air.
Hi, Jim. I recently talked to a psychologist over the phone, teledoc, and all she did the whole time, and I could hear her, was clicking away on a typewriter, writing down everything I said, and gave me virtually nothing, no psychological help at all. And then I also was sitting there, and she had somebody else get on the line with me. And when I talked to that person, all she did was just say, oh, yes, I know how you feel. Oh, yes, I would feel that way, too. Oh, yes, I understand your problem. I mean, that was the psychological help I got. It was just trash. And the other thing I want to say is with United Healthcare, everybody, don't take United Healthcare. They just don't want to pay their bills. I recently got
Okay, and tell you what, I don't want to go down that path. We're staying with our topic of AI, but and I don't know where we're all going in that conversation, but thank you so much, Susan, for calling in today on the program. Peggy is calling from southeast Wisconsin. Peggy, you're on the air.
Hi. I have a healthcare consent form in front of me, and interestingly enough, whenever I go to a doctor's office or the ER, I'm told that I cannot be seen if I do not sign the electronic window. They sometimes call it consented to receive treatment, yet the staff cannot find a paper copy of what they want me to sign because it's just a black screen where you put your signature.
Right.
But I have to sign to be treated. And interestingly enough, on this healthcare consent form, it says I authorize, can I say the name of the hospital system?
Sure.
Advocate Health and my providers to take, collect, capture, produce, use and store photos, video and or audio recordings, reproductions, and digital images of me, including my biometric information, for treatment, training, identification, education, and healthcare operations purposes.
Wow.
And right after that, it says artificial intelligence. I authorize Advocate Health and my providers to utilize computers, electronic devices, and or artificial intelligence systems to provide me and assist me in providing me care, treatment, and services.
Wow.
And it says I authorize access to my external prescription history for facilitating my care. I hereby consent to release of all my pertinent information, whatever that means, in my medical records, including blah, blah, blah.
Yeah.
And it just goes on and on, different points that, of course, we can't read before signing.
Yeah, and Twyla, Peggy is saying, if I don't sign, I don't get care. And
Right.
and here is artificial intelligence right in there.
Yeah, so Peggy, I would love it if you would just go to info@cchfreedom.org and send a picture or a copy or something of that, because I'd love to have all that data. And so, because it would be, I've never heard of a form like that, and so for us to have access to that, that would be very powerful to just show how broad this is. But here's what I'm going to say about you getting care and signing. They have paper forms. They can create paper forms. They don't want to do paper forms. And this is why I say you shouldn't have to do a battle in the exam room, but you do have to. So I encourage people never to go into the portal, never to do the forms before you get there. Always do it there. And then if they say there's no way, then you just say, who's your manager? And then what you can say, which is very effective, is you can say, by forcing me to say yes through only one signature here on an electronic format, you are coercing my signature. And I shouldn't be under coercion for all of these things that you are saying. Now, they might say, well, then we don't want to see you. Okay, well, then at least you know where you're at and you can make a decision about that. You just have to go up to the manager, and the manager might have to go up to the supervisor. And I have done this, and the one time that I did this, she had to produce the papers, and indeed she could find them. And the second thing was that the supervisor told me, well, the only thing you really have to consent to is treatment.
Yeah.
Thank you.
Because that's really what they need.
I keep telling people that who work behind the desk that this is not giving you permission to treat me. This is giving permission to everybody else to get my medical record information, excepting for me. Yeah. I have to jump through lots of hoops in order to try to get my medical records. As well as this consent form, I got this long after I had already been at the appointment.
And Peggy, if you can send a copy of that, a screenshot or something, and that's info@cchfreedom.org.
And
that's
if I'm going to fax it, what would the fax number be?
Oh, yeah, we don't have fax anymore.
Okay.
Great.
Yeah, we don't have fax anymore, but you can give our office a call, and we can figure out how you could mail it or something.
Thank you so much, Peggy. Mike in Pennsylvania, you're on the air.
Hi, I'm having a problem with Medicare. went to the doctor, and I wanted to pay it in, and I called Medicare, and Medicare, I couldn't get a hold of anybody. They made a mistake on my birth date. It's only 2 days difference. They did the same thing with my Social Security. Thank God I'm still getting that check, but this is ridiculous. I think this is all being compounded to use against regular people to make us dependent on the government for our care, and if we don't, then this is part of the end times. That's what I think this is definitely about, and they're all against us.
Thank you for your comments there. And, yeah, indeed, Twyla, he's talking about even the difficulty of correcting errors, and AI is, and we know, as, you know, voice to text and so forth, AI is known for its errors in that regard, and that will only be compounded, is my fear.
That's correct. And we will have facts that aren't facts and truth that isn't actually in the record. And so everybody will have to ask very carefully or listen very carefully to what somebody says when they say, oh, you're still on this medication. No, not on that one. No. You know, I think that we have to listen carefully because we're going to be treated according to what's ever in the medical record. And I will say to the gentleman who was talking about Medicare, we do have a bill, the Retirement Freedom Act, to allow people to opt out of Medicare. But we also have a bill called Make Health Insurance Real Again to allow anyone and everyone at any age to have a major medical policy. So you are not trapped in Medicare and its restrictions.
Thank you for the call. We are completely out of time, and I'm so sorry to other people who are on hold. There's a lot of information you'll find, cchfreedom.org. They have a contact form on their website as well. Twyla, thank you so much for exposing the information and informing our listeners.
Oh, glad to be here. Thanks, Jim.
Twyla Braze from the Citizens Council for Health Freedom. Again, cchfreedom.org. Thanks for joining us on Crosstalk.
You've been listening to Crosstalk via satellite and the internet from VCY America. Views expressed may or may not be those of this station. For a CD of today's program, send a donation of $6 or more to VCY Tape Ministry, 3434 West Kilbourne Avenue, Milwaukee, Wisconsin, 53208, or download by RSS or podcast from crosstalkamerica.com. And join us again for Crosstalk.